Hello, I'm Wally Haas. I'm Executive Director of Transform Rockford and your host for Rockford on the Record. And my guest today is Dr. Alex Stagnaro-Green of the U of I College of Medicine in Rockford. And we're here to talk about some of the great programs that the college is involved with dealing with mental health challenges. But before we get into any of that, Dr. Stagnaro-Green, can you please tell us just a little bit about your background, how long you've been in Rockford, and
Sure.
what your focuses have been?
Sure. Well, I'm an internist endocrinologist, so I'm a New York guy. I trained in New York City at Mount Sinai for medical school, then did 3 years of training in internal medicine in New Jersey, 2 years in endocrine, and afterwards I've stayed in academic medicine throughout my career. Two components. One is research on thyroid disease and pregnancy, not why I'm here today, and the other aspect is working in medical school administration, curriculum, and over the last 10 years as Dean of the College of Medicine in Rockford.
Okay. Now, you've got a lot of initiatives working in the mental health field.
Yes.
So where do you want to start on that? Yeah, I've got a list of here that's pretty good.
You could pick whatever one. And we have a strong commitment to that and happy to discuss any or all of them.
How did that commitment come about? How did your board of directors say, hey, we need to be doing this? How did that happen?
Sure. I think it was internal to the organization, not so much. Our board is based in Springfield, and it's based in Urbana-Champaign, and it's the board for the whole University of Illinois. So it covers this vast, wonderful organization. But we in Rockford, as part of the College of Medicine, believe that we have a very strong commitment to the community and want to do what we can as a medical school to improve the health and well-being of the community. There have been a lot of studies over the last 5 to 10 years, many of which you're familiar with, that have shown that mental health is a major issue within the Rockford Winnebago community. We have a higher rate of depression, we have a higher rate of suicide, we have a higher rate of drug abuse, we have a higher rate of fatality from overdoses than most of the areas within Illinois. This has become an initiative of the city and of the county. And as the medical school of the county, we feel very responsible to be part of that.
Well, kudos to you for that.
Well, thank you.
Too often, we don't discuss mental health issues unless there's a crisis. And I don't think we discuss often enough the lives that have been changed, saved, and altered a little bit because of services that are available, because of programs that are out there. Now, for years, Winnebago County never had a dedicated stream of revenue for mental health services. That changed in 2020 when voters approved the half-cent sales tax. And because of that sales tax, it was able to finance some of the programs that you've been able to initiate. Is that correct?
That is correct. And I think the sales tax was a reflection of the community coming to grips with the fact that it really is a crisis, that there are not enough health professionals, there's not enough programs, and there's a true unmet need. And we're not going to be able to move as a society where we want to without addressing that. Getting back to your comment, many times people don't like talking about mental health. They believe it's a sign of weakness or something that they should be ashamed of. Our belief is very different in the medical profession. It is a disease and problem like any other medical problem, and we need to face it head on, and we need to talk about it, we need to support it, and we need to treat it, and when possible, we need to prevent it. So all that is part of background.
Yes. You mentioned mental health professionals. Now, one of your programs is to train professionals so we have more available, right?
Well, that's correct. So we're a medical school.
Right.
Each year we get 55 medical students. We are a 4-year medical school, so they start out first-year medical students. We began last week with a white coat ceremony, and 4 years from now, they'll be graduating at the Coronado. After 4 years of training, they get their MD degree, but they're not ready to practice out in the community. So they then go on to another 3 to 7 years of training, depending upon what you want to go into. So for me, it was 4 years of medical school, 3 years of training in internal medicine and 2 years then going into endocrinology. But our students go into all the fields of medicine, including psychiatry, which is an area across the country that there's just not a sufficient number of individuals.
Now, how long is the path to become a psychiatrist?
The path to psychiatry, 4 years of medical school, and my recollection is 4 years of training. I'm blocking out if it's 3 years or 4 years.
Mm-hmm.
But that may not be the end of it, because then you might want to specialize. May want to specialize in child psychiatry another year, adolescent psychiatry. Becoming a physician is just a huge commitment of time.
Mm-hmm. So in the psychiatry initiative, which is one of the programs that you have here, creating that pathway, when someone completes the program, are they committed to staying in the community, or can they go anywhere?
Well, let me take it a step back, because the program you're referring to is the SWAT grant.
Right.
So that's actually not for physicians.
Okay.
So that is to train more social workers to stay within the community. So I'll give you a sense about how that all came to about, because that, although it's part of the health professions, it's social work has not been the focus of the College of Medicine. It really has been training the MDs. We also have a College of Pharmacy, and we have a College of Nursing. At some point, we hope to bring the College of Social Work as well as allied health and dentistry to Rockford, but that's still in the planning stages. Mm. So the grant that came about was a grant from the Winnebago County Community Mental Health Board. I was not involved with that board. I was involved in supporting the effort to get it passed back in 2020, but I don't sit on that board. But I heard some feedback that what was happening is the board was very effective of giving grants to various organizations to develop exciting and innovative programs to address the mental health needs, but then there weren't enough mental health professionals to do that and to do the work. And in particular, where the lack of health professionals came was in the area of social work. Mm-hmm. And I heard about that for a while, and I talked to one of the members of my staff saying, well, I think there's a way to address that. Mm-hmm. And she then talked with someone else, and before I knew it, I was in front of the Winnebago County Community Mental Health Board talking about my idea, which I don't even think was a really unique idea. It was a takeoff of two programs that exist within our community. One is a program we have at the medical school to address the lack of rural health physicians. So half of the students that we have at our medical school each year, about 27 of the 55, are students who come from rural Illinois. We actually have a recruiter, full-time, who travels the state. He has wonderful credentials. He's a farmer, was a bull rider until he got a cervical neck injury. And he goes and he meets with high school students, college students, pathway programs, and talks to them about the need for physicians in rural health, and looks for those individuals who are willing to come back after their training. Remember, anywhere from 7 to 9 years right. between medical school, residency, and fellowship, and practice rurally. So we've kind of grown our own. We go out to the state, we find individuals, we bring them to the college. They take the same curriculum as other students with an add-on. Think of it as a minor. So their minor is rural health. They then do their training, and 65% of them go back and work in rural areas, more effective than any other program in the country. So we had some experience with kind of growing our own and seeing how that works. And then RPS 205 has a wonderful program. I forget the actual name of it, but it's really to train teachers so that they will be trained within the Winnebago County or Northern Illinois system and then come back to RPS 205 to work. And I'm sure you're familiar with the program.
Yeah, I can't remember the name of it either.
Right, but my understanding is it's been very successful. They take high school students and they put them in one of the pathways to become a teacher. They have certain courses they take, and if they're successful, they then go to Rockford University, spend 4 years there with a, I think, great discount in terms of tuition. They then go to NIU, where I'm pretty sure it's tuition free, to get their master's, and then at the end of it, they have an obligation to come back to work in RPS 205. And that program was started by Aaron Jarrett and RPS 205 a while ago. And so my thought is, putting those two programs together, couldn't we create a pathway for social workers within our community that at the end of it, they would have a commitment, a required commitment to work within Winnebago County? Because we just weren't able to recruit enough. So I went and I spoke to the mental health board, and I said, there has to be a way that we can get RPS 205 and Rock Valley College and Rockford University and the University of Illinois working together to create these pathways. And I said, that's great. Why don't you do it? And
well, hey, it was your idea, right?
yeah, it was my idea. I would have been more than happy if somebody else wanted to run with it, but
Right.
there wasn't anyone else to run with it at that point. And then they shared with me the accelerated grants that they came up with, which was up to $2 million to create novel and innovative programs to address the issue of mental health. So we put together a consortium of people from RPS 205, Rock Valley College, Rockford University, and UIUC School of Social Work, which has a variety of master's programs online, and developed pathways for high school students, employees of Rockford Public School System, individuals who are going to Rock Valley College, individuals that are going to Rockford University. I can go through these pathways if you want. Might be more detail.
No,
But-
this is wonderful. I mean, keep going.
But at the end of the day, students or the faculty can graduate with an associate degree in human services, a BSW, which they could either get at Rockford University or at UIUC, and then even go for their MSW online at UIUC. We worked it out with the school system that those employees who are going to go for the BSW or MSW can maintain their jobs. Through the grant that we received from the Winnebago County Mental Health Board, they get tremendous cuts on tuition. And in fact, in some cases, with other support from Pell Grants and other grants, it might be tuition-free. There's wraparound services to help support them in terms of counseling or incidentals. And then and they can go as far in the pathway as they want. You can go for an associate's degree, you can go forward to a bachelor's, or go all the way for your MSW. And individuals with all those skills are needed within our community. So we put this all together, and in about 2 months, had a group of individuals with a great plan. We put together a proposal, submitted it to the Winnebago County Mental Health Board. They came back with some questions and some clarifications, and then we found out a couple months ago that we were funded and we're off to the races.
Well, this is wonderful. It sounds like, too often we work in silos. And it sounds like this program is a wonderful example of partnerships, aligning resources, and, seeing what the task is and getting it done.
Yeah, I'm so proud of the way the team worked together. There was never a time where there was infighting or this is more my territory or that territory. There was an understanding that Rock Valley College needs to get their accreditation for their Associate of Arts in Human Services. Rockford University is working on their BSW. The UIUC has been incredibly helpful and supportive of trying to get people into their program. Rockford Public School System, an incredible advocate. In fact, RPS could not get funding from the Winnebago County Mental Health Board because they have a member of RPS who sits on their board.
Okay.
So RPS 205 has funded that internally.
Oh, okay. Kudos to them for that.
Yeah,
So
and we have anywhere from $500,000 to $1 million that I would say would be in-kind support, either from the medical school, Rock Valley College, Rockford University, RPS 205, or UIUC.
What's the future of the program? How big can it be?
Yeah, so the future of the program is we're hoping that we can graduate about 40 students a year with all those various degrees, an associate degree, a BSW, an MSW. The future will really depend upon getting appropriate funding. So this is not being funded by the College of Medicine.
Right.
In some ways, people could say, well, this is somewhat outside of my bailiwick because I'm not a social worker. And although U of I has a social work school, we don't have that in Rockford. So we give a fair amount of in-kind, including my time and others on my campus, but the funding will need to come externally to continue it. And this is where we hope that the Winnebago County Mental Health Board, that the half-cent sales tax, which has just been put on the ballot for this November, will be continued and will be supported, and there will be an appreciation by our community of how important that is. We will then apply for continued funding. I feel confident that if this case, we would get the funding, and we would have to show that we're having individuals who are coming out and trained. I'm very optimistic about that. I think it's a wonderful opportunity for the students. It's a wonderful opportunity for faculty. You could be a faculty member at RPS 205 or an administrator with a associate degree and say, you know what, I want to be a social worker. And over 4 or 5 years, you could do that, get most of it paid for, and continue your job and continue your salary. And you end up with a new career.
That's amazing.
Yeah.
But it all is contingent on maintaining that funding that's coming through that half-cent sales tax.
It is. I mean, if it wasn't there, we would have to look for other sources, and I think there could be some sources, not to the same extent. Probably the program would have to be winnowed down a bit if that was the case.
Okay. Well, I hope that I hope voters see the value in.
Well, I hope so too.
There's been, if you've watched our previous episodes, you see that there's a lot of good work that's going on. That is because of the funding that comes through this mental health sales tax, and that needs to continue for the good work to go on. But we've talked just about one program here, but you've got others. Let's
do Merit.
Let's do Merit. Okay,
let's do
go with
Merit, because Merit
Okay.
is probably the longest standing.
Okay.
So Merit is the Medical Evaluation Response Initiative Team. I think I got the name
You got
right.
it right. Yes.
What Merit does, and it's been around for almost 20 years, is part of our Department of Pediatrics. And what we do, and we have a physician there and social worker and trained nurse practitioners, is we serve as a place to evaluate children who, at any age from birth to 18 years of age, who there's a question of whether or not there's been child abuse, child neglect, or sexual abuse. And so we serve as a place where those children come in, we evaluate them, we then will work with the police when need be in terms of going to court in regards to testimony. And it's an area that we've supported, not only Rockford and Winnebago County, we now support about 14 other counties within our area where children could be brought here. It's a safe environment. It's a beautiful environment. We have people who are very trained how to deal with these very difficult and sensitive issues. Unfortunately, we get about 400 kids a year.
So you said 400?
400 kids a year.
Wow.
And we know that there are many children that are not getting referred to us. In fact, during COVID, we were very concerned because kids weren't going to schools, they weren't going outside their houses. So probably there would be a fair number of cases of child abuse and neglect that wasn't coming to the fore. Anyway, so it's about 400 cases a year. And what we've recently done, and here we worked with the community, I forget if it's the Community Foundation or the Winnebago County Mental Health Board, but we received funding to hire a social worker to work for the next couple of years. It's the Winnebago County Mental Health Board, by the way.
Okay, all right.
Now that I'm thinking about it, but received funding from the Winnebago County Mental Health Board to hire a social worker to work with a number of those children after the child abuse. Some of those children go to Carrie Lynn, but there's other children for various reasons that are not able to go to Carrie Lynn or other programs, and so we're trying to subsume responsibility and help work with the kids and help work with the families.
What's the age range when you talk about children? What's
0 to 18.
0 to 18. Okay. So there's another example. There's a need in the community, and you're able to fill that need.
Correct.
Okay. So then another one on this list is the CARE program, Compassionate Appreciation for Recovery and Everyone. So what's
Sure.
that about?
Okay, so this was our Department of Family and Community Medicine who obtained this grant again through the Winnebago County Mental Health Board. But I need to wind it back a little bit to understand where we're involved in correctional facilities. The medical school, for as long as I've been here, and I'm sure for a while beforehand, we are the healthcare professionals for the Winnebago County Correctional Facility and the Juvenile Center. So there's could be as much as 700 inmates within Winnebago County. Thankfully, a much smaller amount, I think about 30 or 40 within the Juvie Center.
Mhm.
But all those individuals, when they come in, need to be evaluated, and then there's ongoing care. We have 24/7, 365 health professionals available for that. We have physicians who are working there. And one of the issues that became clear is that of substance abuse. And what happens with those individuals had problems with substance abuse once they are released from the prison. The concern is recidivism, that they may go back to the community or may go back to a situation which is a high chance of then restarting their drug use. So what we've worked with the jail system and the correctional facility and our clinical care at LP Johnson Healthcare Center on State Street right by Swedes is a handoff from those individuals. When they get released from the correctional facility, they then get plugged into our healthcare substance abuse program. And we had a couple hundred individuals that was the case last year.
Mhm.
So that's a program we're really excited about and think that it could have a benefit effect for those individuals and ultimately for society.
How do you measure success on a program like that?
Yeah, that's a really good question. I would say, probably the measure of success would be the recidivism rate.
Mhm.
You know, is there a difference, and do we have successes where those individuals do well and do not go back to their substance abuse?
You have any data on that as yet, or
Not
is it
yet.
still
The program's too new. I think it's
okay.
about a year or 2 years old.
Okay.
So I
so-
think we're too early in that regard.
All right. Then the next one I got on this list is CLEAN program, clinical learning and education in addiction, or is it?
Yep.
That's okay. So
So this was another grant from the Winnebago County Mental Health Board.
we're
and
singing a familiar tune here,
we
right?
are singing a familiar tune, and that's really important for the viewers because without that support, and it's really just a half cent,
Mm-hmm.
on your dollar. I before I came here today, I was looking at their website,
Mm-hmm.
and they have a 2-minute cartoon
Mhm.
about the Mental Health Board, and they have a $20 bill, and they show, if you buy something for $20, 10 cents, just 10 cents will go to help this mental health crisis. That comes to about $15 million a year.
Mm-hmm.
10 cents really adds up.
It does. Yeah.
Anyway, so this is another way to address the problem of mental health, kind of a different way. We talked about medical school training being 4 years of medical school, followed by 3 years of residency, 3 to 5 years of residency, and potentially a fellowship. The College of Medicine, along with Swedish American Hospital, UW Swedes, has a residency in family medicine. So we have individuals who train for 3 years in family medicine. After you finish those 3 years of training, it's called a residency, you can do more training, the fellowship. And you can do fellowship in a variety of areas. You could do it in sports medicine, but we've now developed a program in addiction medicine. So an individual, a physician, when she or he completes their family medicine training, can spend a year doing that. They then have the special training to work in that area of drug addiction. And the hope is that those individuals would feel compelled to stay within the Winnebago County and increase the number of physicians in this case addressing that problem.
There's quite a bit of mental health issues and addiction issues seem to go together in many cases.
That's true.
And so when you're dealing with addiction, you're actually a byproduct of that is dealing with some of the other issues that the individual is facing.
Well, it's even broader than that, Wally, because you also have to deal with the social, what's called the social determinants of health. Where are those individuals living? Do they have a job? Can they support themselves? You want to make sure that they're in a safe environment, because all of those could be stressors that lead people to substance abuse or impact their mental health.
Right. That's good. So what haven't we talked about that we should talk about?
Well, when I think about it, I would go back to the overall sense of the medical school feeling a commitment to the community.
Mhm.
Uh, this was a problem in academic medicine, and it's been written a fair amount over the last 20 or 30 years. As medical schools grew very large, they became somewhat insulated from the community. So there's the ivory tower of the medical school and the research going on and the training and the clinicians, and not as much interaction with the public and with the community. One of the reasons why I took this job is I believe it has to be a two-way street. Society supports us. We receive funding from the state to train our medical students and I think to improve health and well-being in our area. So it's that philosophy that keeps on driving us. Another program that probably a lot of people here would be familiar with is what happened during COVID. During COVID, there was all the questions of where are you going to get tested and how quickly would you get the results. You may or may not recall that the National Guard actually came to our campus and set up for about 9 months, which we were really proud of. But when they left, there was a vacuum within Rockford and Winnebago community. So we decided to create the testing center. It's one of the 2 testing centers that ended up in Winnebago County. We took care of over 60,000 individuals.
I was one of them.
Oh, okay. I was one of them too. And then we developed a lab, and this was based on some of the science from the University of Illinois. It was the saliva or spit test, and you kind of drool into a test tube. We developed the capability to run that on our campus. It was a PCR lab, and we were able to get results, I'd say, to more than 95% of the individuals within 24 hours. Many people the same day.
Right.
And that just allowed people to go back to work or to isolate or to do what they needed to do, as opposed to waiting 3 to 7 days, which was the norm in society at that time.
Yes, sir. So any final thoughts?
No, I think that's it. We continue to look for ways that we can be part of our community. Our students are active in so many different organizations. Many of our faculty and administrators head various organizations and not-for-profits. And it's a wonderful way to teach our medical students. They see by example that becoming a physician doesn't mean you're just going to take care of the patient in your room. You have a bit of a larger responsibility, and you have to decide what you would like to do with that in terms of working with the community and giving back some of the expertise that you have just to make things better.
I commend you for the work that you're doing, not just in the mental health field, but overall with the College of Medicine. It's really been one of the gems of Rockford over the years, and I thank you for the work that you're doing.
It's our pleasure. We feel very, privileged to be able to do this type of work.
Thank you. So you've heard a few times during this program and other programs about the value of the Winnebago County Mental Health Sales Tax. That half-cent sales tax is vital to finance some of the programs, some of the good work that is going on in this community in the mental health field. And if we want to see those programs continue, voters need to say yes again in November, and I encourage you to do so. So thank you very much, and we'll see you next time on Rockford on the Record. I'm Wally Haas.